Hello, my name is Blake Alkire and I'm an otolaryngologist in Boston and one of the founding members of the Global Otolaryngology Head and Neck Surgery Initiative. The purpose of this very brief presentation is to get members up to speed that may have joined just recently, so everybody's on the same page. This initiative grew out of a conversation following an excellent conversation in the humanitarian section of the 2019 American Academy of Otolaryngology meeting in New Orleans. There was significant enthusiasm from a group of medical students, residents, and attendings or consultants around the idea of starting to apply some of the principles of the broader global surgery movement to the already burgeoning global otolaryngology movement. Much of the enthusiasm for this initiative was rooted in the outstanding work that was being done and led by many of the colleagues that have joined this initiative. Our professional societies, including the American Academy of Otolaryngology, along with the International Federation of Otorhinolaryngological Societies, has also had a strong presence in the realm of global surgery and global otolaryngology, especially with regard to education and humanitarian efforts. Our major inspiration can be found in the work of the Lancet Commission on Global Surgery, which was published in 2015, which generated a significant amount of primary research in the world of global surgery with regard to access to care, the economic consequences of lack of access to care, and then laid out a significant number of policy directives, many of which have been put in place at both the national and international level. The Lancet Commission on Global Surgery really helped to prioritize surgery in the broader global health realm. Additional inspiration was found in a collaboration by our neurosurgical colleagues who performed what I like to call a mini Lancet Commission. They generated primary research, both through the use of surveys and modeling, to estimate the unmet need of neurosurgical conditions worldwide and at the country level, and then have used this effort to generate priority within global surgery and the broader global health arena. As we began to consider how an initiative could complement the work that was already being done in global surgery and global otolaryngology, the founding members quickly coalesced around an agreed upon vision. After agreeing upon and establishing equity as a centerpiece of the initiative, we looked to the templates provided by the Lancet Commission on Global Surgery and our neurosurgical colleagues, specifically with regard to the generation of primary research centered on needs assessment and capacity development, which can then go on to inform policy recommendations and even advocacy efforts. The prior initiatives also early on clearly made collaboration with other stakeholders a major priority. Our ultimate goal is to ensure that our patients who suffer from conditions of the head and neck are able to access high quality, affordable, safe ENT care when they need it. I'd now like to quickly provide an update on what the initiative has been up to since its founding. Early on, we attracted significant interest from medical students and residents who initiated some early literature reviews and some early research projects, including systematic reviews, which are still ongoing today. Starting in December of 2020, we had enough members to begin to think about research themes and early on decided to break up into 3 working groups: workforce, training and education, and burden of disease. The initial goal was to facilitate discussions mainly through WhatsApp groups, but also to be able to foster more robust discussion during our Saturday discussions. Eventually, the active members of the initiative decided that the first priority is to define an essential list of ENT procedures along with conditions that contribute to the majority of the burden of disease. We elected to do this through a Delphi process. The goal of this process is then to inform future major research projects. Also, starting around the same time, group members began to form teams to focus on specific bite-sized research projects, such as commentaries regarding COVID-19. More broadly, the group has recently been concerned with how to more formally structure and organize the initiative. All along the way, we've been actively recruiting to ensure that we're casting the widest net as we can. Finally, I wanted to provide a brief overview of how the group is currently envisioning the major research initiative. After completing the initial Delphi process to create a list of priority ENT conditions and procedures, we will then use this to inform discussions in our working groups, which will then generate a list of priority research themes. Given that we are explicit in our desire to have the research themes driven by our colleagues, we don't know quite yet what that will look like, but discussions have included a broader assessment of workforce capacity, quality of care, barriers to care, implementation of training and education programs. I'd like to end by saying thank you once again for your interest and participation in this initiative. Thank you once again, and I look forward to working with all of you.